Welcome to our NCLEX Psychiatric Nursing series. Psychiatric nursing is a special area of nursing that helps people with mental and emotional health problems. The nurse cares for the patient's mind as well as the body. The main goals are to improve mental health, prevent mental illness, help patients recover, and support their families. Nurses also teach patients healthy ways to cope with stress and emotions. A psychiatric nurse listens to patients, checks their mental health, gives medicine safely, teaches coping skills, and helps patients feel safe and respected. Psychiatric nurses work in hospitals, mental health clinics, emergency departments, rehabilitation centers, schools, and community health centers. They care for patients of all ages. For NCLEX questions, always remember this order. Patient safety comes first. Then use good communication. Assess the patient carefully and protect the patient's rights. Remember these 4 key points. Promote mental health, give kind and respectful care, communicate well, and always keep the patient safe. Mental health means a person can think clearly, control emotions, handle stress, and enjoy healthy relationships. Good mental health helps us live a balanced and happy life. A mentally healthy person can solve problems, adjust to change, control emotions, and build healthy relationships with others. Mental illness affects the way a person thinks, feels, or behaves. It can make daily life, work, school, or relationships more difficult. Many things affect mental health, such as family, stress, life experiences, physical health, and genetics. These factors can increase or decrease the risk of mental illness. The nurse looks at the patient's appearance, behavior, speech, mood, and daily activities. Careful assessment helps the nurse understand the patient's condition. Remember this NCLEX point: mental health helps a person function well, while mental illness makes daily life more difficult. A good nursing assessment is always the first step. The mental status examination, or MSE, helps the nurse understand the patient's mental condition. It checks how the patient thinks, feels, speaks, and behaves. First, observe the patient's appearance and behavior. Look at clothing, hygiene, eye contact, posture, facial expression, and body movements. Next, listen to how the patient speaks. Ask about their mood and compare it with their facial expressions and emotions. This helps identify mental health problems. Check if the patient's thoughts are clear and logical. Also look for hallucinations, delusions, unusual beliefs, or thoughts of self-harm. Test the patient's memory, judgment, and insight. These show if the patient understands their condition and can make safe decisions. To remember the MSE, think of this order: appearance, behavior, speech, mood, thoughts, memory, judgment, and insight. This is a very important NCLEX topic.
Therapeutic communication is a purposeful conversation that helps build trust, encourages patients to express feelings, and supports emotional healing. It is one of the most important psychiatric nursing skills. Active listening means giving the patient your full attention. Maintain eye contact, listen without interrupting, observe body language, and show genuine interest in what the patient is saying. Ask open-ended questions too. Encourage patients to describe their thoughts and feelings. Avoid questions that can be answered with only yes or no. Reflection repeats the patient's feelings to encourage deeper discussion, while clarification helps confirm that the nurse correctly understands the patient's message. Avoid giving false reassurance, judging, changing the subject, arguing, or giving personal opinions. These responses can reduce trust and block effective communication. Remember these NCLEX rules? Listen first, ask open-ended questions, reflect feelings, clarify responses. and always communicate with empathy, respect, and professionalism.
The first step in a good nurse-patient relationship is trust. When patients trust their nurse, they feel safe to share their thoughts, feelings, and concerns honestly. Empathy means understanding how the patient feels without judging them. The nurse listens with kindness and shows care and respect during every conversation. A nurse should always keep professional boundaries. Be friendly and respectful, but do not become a personal friend or share private information with the patient. Everything the patient shares should be kept private. Only share information with the healthcare team when it is needed for safe patient care. The relationship has 4 phases: pre-interaction, orientation, working, and termination. Each phase helps the nurse provide safe and effective care. For NCLEX, remember these key points: build trust, show empathy, keep professional boundaries, protect confidentiality, and understand the 4 phases of the nurse-patient relationship. Defense mechanisms are ways people protect themselves from stress, fear, or anxiety. Most of the time, people use them without even knowing it. Denial means the person refuses to accept the truth. Even when the problem is real, they act as if nothing is wrong. Projection means blaming someone else for your own thoughts or feelings. Instead of accepting their own emotions, the person says someone else feels that way. Displacement means taking your anger or stress out on a safer person or object instead of the real cause of the problem. Regression means going back to childish behavior during stress. For example, an adult may cry, refuse to talk, or depend on others when feeling overwhelmed. Remember these common defense mechanisms for NCLEX. Denial means refusing the truth. Projection means blaming others. Displacement means moving feelings to a safer target. Regression means acting younger during stress.
Anxiety is a feeling of worry, fear, or nervousness. A little anxiety is normal, but too much anxiety can affect daily life. Mild anxiety helps a person stay alert and learn better. The person can still think clearly and solve problems. Moderate anxiety makes it harder to focus. The person may feel restless, worried, and need help staying on the task. Severe anxiety makes it very difficult to think clearly. The person may feel afraid, confused, shaky, and unable to concentrate. Panic is the highest level of anxiety. The person may lose control, feel extreme fear, and have trouble thinking or communicating. Safety is the nurse's first priority. Remember the 4 anxiety levels: mild, moderate, severe, and panic. For NCLEX, always keep the patient safe and stay calm while giving care. When caring for a patient with anxiety, the nurse should stay calm. A calm nurse helps the patient feel safe and less anxious. Move the patient to a quiet place. Less noise and fewer distractions help lower anxiety and improve focus. Speak slowly and use short, simple sentences. Give one instruction at a time so the patient can understand easily. Teach the patient slow, deep breathing and relaxation exercises. These simple techniques can help reduce anxiety. Some patients may need medicine to reduce anxiety. The nurse should give the medicine safely and watch for side effects. For NCLEX, remember these steps: stay calm, keep the patient safe, reduce noise, speak simply, teach deep breathing, and give medicines safely. Depression is more than feeling sad. It is a mental illness that can affect a person's thoughts, feelings, sleep, appetite, and daily life. Common signs include feeling sad most of the time, losing interest in favorite activities, feeling tired, sleeping too much or too little, and having trouble concentrating. Mania is the opposite of depression. A person may have very high energy, talk very fast, sleep very little, and make risky decisions without thinking. Bipolar disorder causes mood changes between depression and mania. A person may feel very sad at one time and very energetic at another time. The nurse should listen carefully, keep the patient safe, encourage medicines as prescribed, and watch closely for signs of self-harm or suicide. For NCLEX, remember, depression causes low mood. Mania causes high energy. Bipolar disorder includes both. And patient safety is always the nurse's first priority. Schizophrenia is a serious mental illness that affects how a person thinks, feels, and behaves. It can make it hard to know what is real and what is not. Positive symptoms are things that are added to normal behavior. These include hallucinations, delusions, and disorganized speech. Negative symptoms mean normal behaviors are reduced. The person may show little emotion, talk less, avoid people, and lose interest in daily activities. Hallucinations are seeing or hearing things that are not there. Delusions are false beliefs that stay strong even when there's proof they are not true. Stay calm and speak clearly. Do not argue about hallucinations or delusions. Keep the patient safe, give medicines as prescribed, and build trust. For NCLEX, remember, positive symptoms include hallucinations and delusions. Negative symptoms include little emotion and social withdrawal. Always keep the patient safe and communicate calmly. A personality disorder is a long-term pattern of thinking and behaving that make it hard for a person to build healthy relationships and manage daily life. Cluster A includes paranoid, schizoid, and schizotypal personality disorders. These patients often seem suspicious, quiet, or socially distant. Cluster B includes antisocial, borderline, histrionic, and narcissistic personality disorders. These patients may have strong emotions, act without thinking, or seek attention. Cluster C includes avoidant, dependent, and obsessive-compulsive personality disorders. These patients are often anxious, fearful, or depend too much on others. The nurse should stay calm, set clear limits, communicate with respect, and build trust. Consistent care helps patients feel safe and supported. For NCLEX, remember the three groups. Cluster A is odd, Cluster B is emotional, and Cluster C is anxious. Always communicate calmly and keep professional boundaries. Obsessive-compulsive disorder, or OCD, is a mental illness. A person has unwanted thoughts called obsessions and repeats certain actions called compulsions to reduce anxiety. Common signs include repeated hand washing, checking things many times, counting, arranging objects, or having unwanted thoughts that cause anxiety. Post-traumatic stress disorder, or PTSD, can happen after a very frightening or dangerous event. The person may keep remembering the event and feel afraid for a long time. People with PTSD may have nightmares, flashbacks, trouble sleeping, feel nervous, and avoid places or people that remind them of the traumatic event. The nurse should listen without judging, provide a safe and calm environment, encourage healthy coping skills, and give medicines as prescribed. For NCLEX, remember, OCD includes obsessions and compulsions. PTSD happens after trauma and may cause flashbacks and nightmares. Always provide calm, safe, and supportive care. Substance use disorder happens when a person cannot stop using alcohol or drugs, even when it causes problems at home, work, or school. People with alcohol use disorder may drink too much, lose control, and continue drinking even when it harms their health or relationships. Opioids and stimulants can be very addictive. They affect the brain and can lead to serious physical and mental health problems. When a person stops using alcohol or drugs, withdrawal may happen. They may shake, sweat, feel anxious, have nausea, or trouble sleeping. The nurse should monitor the patient closely, provide a safe environment, encourage treatment, give medicines as prescribed, and offer emotional support. For NCLEX, remember, recognize addiction, watch for withdrawal symptoms, keep the patient safe, and support recovery with proper nursing care. Some people have a higher risk of suicide. Risk factors include depression, previous suicide attempts, substance abuse, feeling hopeless, and major life stress. Warning signs include talking about death, giving away personal belongings, withdrawing from family and friends, and sudden changes in mood or behavior. If a patient is at risk, never leave them alone. Remove harmful objects, stay with the patient, and ask directly about suicidal thoughts in a calm and caring way. During a crisis, stay calm. Listen carefully, offer hope, and make sure the patient receives immediate help and support. The nurse should build trust, encourage the patient to talk, involve the healthcare team, and continue close observation until the patient is safe. For NCLEX, remember, recognize the warning signs, ask directly about suicide, never leave a high-risk patient alone, and always make patient safety your first priority. Antidepressants help treat depression and anxiety. They improve mood over time, but they may take a few weeks before showing their full effect. Antipsychotic medicines help reduce hallucinations, delusions, and confused thinking in patients with schizophrenia and other psychotic disorders. Mood stabilizers help control mood swings in bipolar disorder. Anti-anxiety medicines help reduce anxiety and panic symptoms when prescribed. The nurse should give medicines safely, watch for side effects, teach patients how to take their medicines correctly, and encourage them not to stop medicines without medical advice. For NCLEX, always monitor for side effects, assess the patient's response, promote medication adherence, and make patient safety your highest priority. Congratulations! You have completed Part 1 of Psychiatric Nursing. Review these topics often and practice NCLEX questions to build your confidence and succeed in your exam.